Welcome everyone. I'm so pleased that you're here. This is a little bit more formal than I had wanted, but it's fine, and you're all settled around the tables. I'd first like to acknowledge the traditional owners of the land, the people of the Eora Nation, and I pay my respect to their elders past and present. So this came about, this meeting really came about soon after the Hub Council, and Raj will say a few words. A Hub Council in mid-September, Raj sent me a note saying, would you like to know how the ACI sees, the Agency for Clinical Innovation sees the area of translational research and implementation science? And I said, of course. At that time, our office of about 17 staff, we had decided to embark on an education and training program for our staff. And we'd already had and it was going to be Monday mornings, or we already had a show by one of the senior directors in this space on proteomics, and that was really great. And so this was really good also. And it was very fortuitous that a month or so earlier, I had the opportunity to meet on separate occasions Professor Rebecca Ivers and Tamika Heiden, and to talk about similar things in translational research. And so I thought it'd be good to have all three talk to the office, and given that the Hub Council are really very interested in the whole area of embedding quality research in the health system, I thought it'd be good to invite the Hub Council. So it was a limited group of people, because I didn't want it any bigger than that. So it's really a discussion information session, really about trying to, for us, myself more, try to understand the space, so that if I'm going to have an impact through policy, I'll try to, you'll help us. And there'll be ongoing discussions, so this is the beginning. The aim is for us to learn a little bit more. We'll create some notes and we'll give it to the Hub Council for their information. And it's a journey for us, for me, it's understanding more about this space and the language that we use, which sometimes for me is a bit confusing. So Raj, did you want to say a few words?
Thanks, Tony. Good morning, everyone. My name's Raj Verma. I'm the Director of Clinical Program Design and Implementation, and that word implementation is pretty key to what I'll be talking about today at the Agency for Clinical Innovation. And this came about just, as Tony said, an offer to run his team through what we're thinking implementation looks like. And I've been to a number of implementation science conferences myself, and being involved with people at the front line, it seems very esoteric and still very academic. And when I attended the Hubs Council, and there's, I don't know what the number was, $40 million or something for translational science. And again, most of the stuff that I was hearing about there was really at the clinical research end. It's still at the creating guidelines. What does best practice look like? And I've been involved in quality improvement for 20 years, and the worlds of research and quality improvement only slightly, the Venn diagrams only very slightly overlap, it would seem, a lot of the time. So we've, at the ACI, appointed a research manager, Professor Iedema, who will talk to you in a moment, to really research what we do and how we implement. And so there's a lot of lessons about minute frontline, how do clinicians talk to each other, how do central agency people work with them, how do they work themselves, and examining how we do our work. And it's not something that we're used to doing. So I really wanted to start a conversation with Tony about, at this, it might be at this extreme end of what the research community might think is research, but can we do more of it? Can we do more of it at the front line? And, can we start a conversation about it? So that's all I wanted to say. It's great to have everyone here. It wasn't the original plan, but I think the more people who hear about it, the better. Rick's research, I'm not sure we got a chance to embed the link we did, but we've only just published it in grey literature. So again, this is, he'll probably get some papers done, but on our website last Friday. So this is really fresh stuff, and I look forward to hearing more about it.